Let's talk more about undocumented migrants and the South African healthcare system. We can speak tonight. We're joined by a guest from Section27, the head of health rights, Sasha Stevenson. Sasha, good evening. Welcome to News at Prime. Let's begin with the basics. What are the obligations of the South African government from a healthcare perspective to someone who's in the country as an undocumented migrant illegally?
I think we've got to start with the Constitution that says everyone has a right of access to healthcare services. It doesn't restrict that right to citizens or to people with documentation. And then we go down to the National Health Act, which again provides for free healthcare services, and in particular in relation to the video that you showed, is the provision that the state must provide free healthcare services for pregnant and lactating women and children under the age of 6 who are not members of medical schemes. And so in many ways the law is quite clear. It requires that everyone in South Africa be provided with healthcare services, and particularly in respect of hospital services, it makes it very clear that pregnant women and children under the age of 6 are entitled to be provided with such services, and it does so for good reason.
What do you say then to people like the Johannesburg Health MMC, whom I spoke to on this very program last night, who was saying that the reality is the flow of illegal immigration into South Africa is putting unnecessary pressure on South African health facilities and therefore disadvantaging South Africans who rely on those very services, compromising their ability to rely on hospitals such as the Rahima Moosa Mother and Child Hospital?
So I would say firstly that these statements are frequently made and made without much by way of evidence. There tends to be very little effort to measure actually the number of people who are South African, who are refugees, who are asylum seekers, who are undocumented, who are accessing services in the public health sector, and instead they become a very easy population to target when wanting to shift the blame from other things. I think when we look in Johannesburg, there are a number of things we need to consider. First is that the health budget, as in our last budget in February, is decreasing in real terms. So taking into account inflation, the health budget across the country is decreasing by 4.3% every year for the next 3 years. We're getting a bigger population because there is population growth, and yet we're spending less money on health every year. So that's one cause of the difficulties and the strain on health facilities. The other thing that we've got to recognize just quickly is the closure of Charlotte Maxeke Hospital for the last year. This is a huge hospital that serves a large portion of southern Gauteng, and it hasn't been available for services. And so we are seeing huge amounts of pressure on other hospitals across the province. And to blame it on migrants or on undocumented migrants is really to do so without evidence and consideration of the realities.
The CEO of the Rahima Moosa Mother and Child Hospital was interviewed on radio this morning, and one thing she said from the reports I've seen is that about 40% of the hospital's intake is made up of foreign nationals. Now, there wasn't clarity given on what percentage of that stat is actually in the country illegally. How then do we address it? What is the solution, given that there is this growing feeling that this is a serious problem?
There's a growing feeling, and I think we've got to establish what the reality is. You're right. There's no disaggregation of how many people fall into what category. There's just these bland statements, and these bland statements have been being made for years. I think the message really is that we cannot use the health system to remedy what we consider to be problems within the Home Affairs or border control system. You can't use health to disadvantage people when they are within South Africa. South Africa has signed up internationally to various pieces of law, various international and regional laws that require us to treat people in a certain way, and we've said we'll do so under our Constitution and in terms of our National Health Act. And so it's insufficient to blame the problems in our health system on migrants and to seek to punish migrants through the health system when we're failing to take steps in other ways that could deal with some of what is perceived to be an immigration problem.
A suggestion by the DA today is that the embassies of the countries that these mothers, for example, who give birth at not Charlotte Maxeke, but Rahima Moosa, their embassies should be made to foot the medical bills. Is that fair?
There are provisions that allow for that. I don't know if it's ever actually been done. It between provinces as well. So, for example, if there's a person who lives in Mpumalanga and requires services that can only be provided in Gauteng, there are provisions for the transfer of funds. That kind of thing is possible. I don't know that it's the full solution to the problem, but certainly it's not beyond the realms of possibility. But I think we do need to, before we start looking for the money elsewhere, we need to know what it is we're actually spending, rather than making videos and making broad sweeping statements that whips up xenophobia across the country in a way that I think is really dangerous.
There have also been claims, I'm sure you've heard this as well in the past, anecdotal or real, of women, for example, from neighboring countries crossing into the likes of Limpopo and perhaps even into Mpumalanga in order to be able to give birth in South Africa. Is that something you've explored to see just the extent of it?
We haven't explored it. We don't know the extent of it. I think the government doesn't know the extent of it either. And as I said, in the National Health Act, it specifically provided that all pregnant women are entitled to free healthcare services. So if that's something that we're concerned about, it's something that can be dealt with separately. But what we have undertaken to do as South Africa is to try and decrease the maternal and child mortality rates. And by trying to exclude women who aren't from South Africa from access to healthcare services, we're only shooting ourselves in the foot, because we're going to go back on the advances, the real and important advances that we have made in protecting women and children.
But Sasha, it's also a border control issue, isn't it? Because if the borders and the fences along some of these borders were properly set up, properly patrolled, then many of these people would not even be able to make the crossing, no?
Presumably that is so. And as I said, we can't use our health services to try and deal with potential problems in other aspects of the state. We need to, our law is clear. When people are within the country, they are entitled to access healthcare services, particularly in relation to women and children. And given that law, we need to ensure that people are being provided with services instead of making broad and sweeping and I think dangerous statements that whip up fears and anxieties amongst people within the country.
Sasha Stevenson, Section 27 Head of Health Rights. Good to speak to you. Thank you.